Do you have any pain or discomfort?
Yeah, some pain. Upper. There's cavities. Loose tooth, so it's some pain. Sometimes cold water, some cold. When I drink cold water, cold beverages or something, it hurts. And I can't really chew because I don't have any back teeth per se. It takes me longer to chew my food. I have to. We sit down and my wife or friends, they finish eating. I'm still chewing. Why? Because I eat my teeth, And like I say, you can't probably see them, but I know they're there. There's some missing in the back there.
Has there been anything that you've wanted to do that you haven't been able to do because of your
Teeth.
teeth or your smile?
Chewing, it's eating, just really knowing I'm chewing my food. My wife has all her teeth, and me and my wife, we sit and eat, side across from each other all the time, and she just chew her food up and just so, and I can't do it, and I wish I could do that, I just wish I could, finish at the same time per se, or enjoy it like she's enjoying her steak. When I say steak, just food that require a lot of chewing, and I'm just not able to do that. I again, like you say, you can't probably see because these front here, there's a tooth under here is missing. It was, and I had that kind of covered up, so you really can't see all the distortion of my teeth. But I know it's there. Like I said, I know it's there, and it's here's it's loose. It's only like it's supposed to be permanent, been like glued in and bonded in, but when I'm chewing, sometimes I could feel it slipping and sliding, and it's I don't know how long it's gonna last till it come out in any time, And I have this fear when I'm let's again go back to steak. I don't know why chewing food, and I'm thinking it's gonna like fall out. I'd be chewing and it'd be stuck into the meat or something. Be embarrassing, but that's it. Yeah, I had this reoccurring dream, but I know there's not my all my teeth. They've been capped and glued and everything else patched together. And I have this dream sometime that I'm somewhere chewing. I mean, eating some food out in public someplace, and I'm chewing, but I'm starting chewing my own teeth. Like, I just grinding my teeth. They just fell out, and I'm chewing my teeth. And how you do that? Chewing your own teeth with gum in my own teeth. And I said, boy, I didn't. I wake up, oh, okay, it's a dream. Boy, it's something else. But that's some of the things that be thinking about sometimes.
How long have you been like this?
Oh, for you, a lot of years. Probably give us some numbers on it. Probably maybe about 14 years, maybe 15 years, something like that. Yeah, it's been a while.
How come? What inspired you to go ahead and do something about it?
Well, again, like I said, this tooth was out. One front tooth was missing, and it was loose. All of my, I have partial, I guess a bridge here. When they put those bridges in, they grind whatever little tooth you have left. They kind of grind down little stubbles. It look like a Dracula person, And that picture in my head, and I know they're on there, and they give me problems sometimes. There, and I have cavities underneath it, both sides, and they've given me problems. So what are you going to take it off and grind down some more? So pretty soon I won't have nothing to grind down to. Again, like I said, some of the teeth is missing below in the bottom here, in the top. When I was growing up, only time I went to the dentist, we were so poor. Only time I went to the dentist to get your teeth pulled. I never went for checkups or to see how your teeth is. Excuse me. So I I never took care of my teeth, and I have a sweet tooth, my teeth, I should say. And I love sweets, and I did proper hygiene, oral hygiene. I never did practice that much, until I got older, and I'm trying to save the few teeth I have. My grandmother wore dentures, and I just can remember her talking and teeth clicking back and forth, and I said, oh man, and that picture's in my head. And again, I may be eating some food, and they slip, fall out, I don't want that. So if I said, well, I need to get this problem taken care of, and I read about it on, I mean, heard about it on the radio, listened to radio. So I called up and said, let me do something about this. It's time to now, you know. Let me do something about it. And I'm not, I'm 67 years old. If I'm fortunate enough to live longer, at some point I'm gonna have to take them all out and have dentures. So, and rather, I don't want the dentures, you know, removable dentures. So let me do this. I'd rather do this implant. So that's the reason why, you know,
Well,
I came to that conclusion.
I think your quality of life is going to be so good. You know, these are going to be so strong. It's going to be just like like you're 20 years old again.
All right.
You know,
I'll
in,
go
this,
for
in
that.
terms of the strength of your teeth and everything. Guys, thanks for coming in again today, Charles. It's good to see you. I remember seeing how you were feeling before your procedure last time, and it's nice to see everything all finished up. What was the recovery period like after the procedure was all done and you got home? How was it? What you expected?
No, pleasantly, I was pleasantly surprised because I was anticipating a lot of pain afterwards, you know, and you know, you get a visual picture, say, well, okay, I'm getting these teeth taken out and different things, and I said, oh, I'm gonna have a lot of pain, but I was pleasantly surprised. I didn't have hardly any pain at all. It was even more pleasant than having one teeth extracted.
Really?
So I was pleased with that. Yeah, really pleased. I was surprised. I'm really surprised. So glad of that.
Oh, that's great.
Yeah.
So if you had, friends or family that were having a similar problem, that was missing some teeth, or maybe had a poorly fitting denture, would you recommend it for them?
Absolutely, absolutely. Cunning Dental Group. Come on in here, please. I would. Yeah, because I'm pleased. It's no joke. I really am. This is from my heart. I had some fillings, like silver fillings, I guess they were, in the bottom there, and that's been taken care of. I don't know if you can see it now, but it's gone. I mean, it's gone. It's gone. You know, and my wife, so she some, she didn't. I didn't tell her what was going on. Like I said, my wife looked at me and said, "Something's different about you, Charlie." I said, "What is it?" I don't know what it is. What is it, baby? She said, well, tell me what it is. She says, something different. And I smiled. She said, oh, that silver spot is gone in your mouth. Those two silver spots, they're like maybe Dracula or somebody, but they're gone now. And it's nice white teeth, all the way around, Here's another thing my wife, she noticed, my wife for 41 years, she always give me a Tic Tac or a breath mint. I said, oh, you talking about my breath again? Well, those rotten teeth, they're gone. And but she said, your breath is pleasant now. She doesn't smoke. She doesn't drink. She has a real keen nose, so she noticed little things like that. And she said, I don't smell. And I said, well, the teeth are gone. Those rotten teeth. That's what that smell was coming from. So that's great. I can give a kiss now without her turning away from me.
So, do you have anything that you would say to someone who's considering having this procedure? If somebody was on the fence and not sure, what would you tell them?
Well, my personal experience. Cunning Dental Group. Go there and they'll address all your problems. Concerning your teeth. Thinking about getting something done. No getting dentures, or I would recommend Cunning Dental Group. Absolutely.